दुबई से पधारे बिहार की धरती पाटलिपुत्र पटना में, तो पटना कैसा लगा आपको? अभी तो आप सुबह ही आए हैं आज।
तो पटना मुझे बहुत अच्छा लगा, क्योंकि जैसे ही मैं आया, मतलब मैं सुन रहा था ड्राइवर से मतलब बारिश, बहुत ज़ोर से बारिश आ रही थी और टेम्परेचर एकदम अच्छा हो गया था और मुझे रोड्स वगैरह एकदम क्लीन नज़र आए। और मुझे आके बहुत, स्पेशली दुबई में अभी टेम्परेचर 45-50 चल रहा है और यहाँ पर आके एकदम सडनली बारिश देख के
तो सुकून महसूस किए हैं।
बहुत अच्छा लगा बारिश देख के। और यहाँ के लोग बहुत मतलब अच्छे हैं, बात करने में बहुत अच्छे हैं
जी। तो आपको अच्छा लगा पटना?
यस, बहुत अच्छा।
तो देखिए, डॉक्टर विशाल पवार जी पटना की पूरी प्रशंसा कर रहे हैं, यहाँ की सड़कों की, यहाँ की लोगों के व्यवहार के प्रति इनका नज़रिया काफ़ी अच्छा है। तो पटना का सफ़र काफ़ी अच्छा रहा सर।
यस,
बहुत बहुत धन्यवाद डॉक्टर विशाल पवार साहब, आपने अपना बहुमूल्य समय दिया।
The speaker is that BNG versus ENG. I think that ENG is CT scan and BNG is MRI, but sometimes like in the calcification you see better than the CT scan. Some quantifications you see better than the ENG. Sometimes when the patient keeps your eyes closed, you can't record the ENG, you find it difficult. But still you can record electric potential in the ENG. So, I mean, there the VAG is superior, but EAG has some small advantages here and there. And I think the wonderful workshop and the wonderful job done by the, I think, Jurgen, I think we will see in the second half the wonderful job we are looking for. And with that I think we end the session and back to the organizers.
He had just one complaint. Whenever I drive, my car starts going to one direction. He said, okay, you stop driving. He said, that's not a choice, because I stay in Qatar, I have to drive to my work. So we said, okay, what are you doing now? He said, I leave early in the hours in the slowest lane so that there is no traffic around. Whenever I see the traffic, I start doing it. We ran all sorts of tests on him, and later we realized probably he suffered from motorist vestibular disorientation syndrome. That was just one case that we saw, and now he's going to come back in July for further rehabilitation and correcting his imbalance issues. So that is what I say, that's the beauty of vestibular rehabilitation. There are subtle changes, there are subtle complaints which we often tend to miss, but they definitely are very debilitating for the patient. Now, the wide spectrum of vestibular disorders, this has been already covered beautifully. We have the peripheral vestibular disorders, we have the central vestibular disorders, we have functional and complex dizziness. Now, that's really one of the most difficult entities, because when we have a patient with a vestibular migraine, with a lot of somatization, it becomes very difficult to break that vicious cycle. And as one of the speakers said, it's kind of a sensation on a board. They keep calling us back and they feel, हमें लग रहा है हम ऊपर उठते जा रहे हैं. कल तक ठीक था, आज सुबह उठे तो लग रहा है. There are very bizarre kind of terms which you may come across, rather than just एक घुंगरी जैसी लग रहा है, वो term बहुत कम ही हमें सुनने को मिलता है. And then yes, gait and balance disorders, they are very much a part of our vestibular rehabilitation group. So now, what is vestibular rehab? It's a targeted therapy for disorders of the inner ear and central balance system. It is rooted in the principles of neuroplasticity and central compensation, and I'm sure most of the rehabilitation experts can associate, because the entire stroke management relies on the neuroplasticity principle. And the core goal is to improve gaze stability, posture control, and reduce dizziness reactions. And clinical Pilates definitely improves lumbopelvic control and proprioceptive senses. So, for vestibular patients, integrating core strengthening with vestibular rehabilitation, it reduces energy expenditure, which is very, very important when we talk about multiple sclerosis patient, where fatigue is one of the delimiting factors for any kind of exercise activity. It enhances movement economy and facilitates functional re-entry, especially in older adult and athletes. Another interesting, this is one of my favorite areas, that is oculomotor and visual training. Now, gone are those days when we used to tell the patient, ऐसे देखिए, ball लेके उछालिए, सिर ऐसे हिलाइए. They do it till they are in our OPD. The moment they are out of the OPD, everything is gone and they are again in their spinning world. So luckily our center is equipped with latest techniques which provide biofeedback. This is the blaze pod, what the lady is doing in our patients. So we are trying to just compare two things, and then we have a lot of other balance tests. We are using CWEMP also. We have the audiometry team that takes care of things. So there are a couple of tests that we regularly do to understand our patients well. So this is video nystagmography, as there was a beautiful topic. I have the electronystagmography and the video nystagmography both. So you know, from cycle, if you get a four-wheeler, you will always love your four-wheeler. You would not like to ride your cycle. But the thing is, the cycle is the base of your balance. If you don't know how to ride a cycle, probably driving a four-wheeler, getting the lane sense would be difficult. So we cannot do without both of them. But yes, with the advent, now we've got a bigger vehicle with us. It is able to look back into the patient history and you know, helps us to understand graphically also where my patient is going. So video nystagmography is something now we feel has become a very integral part of our vestibular
कालों में
rehabilitation.
पधारे दुबई से डॉक्टर विशाल पवार, जो पटना की धरती पर पहुंचे हैं। एम्स में इनका व्याख्यान हुआ है। तो सर, क्या कहना चाहेंगे? न्यूरो की बीमारी तेज़ी से फैल रही है पूरे विश्व में, और पटना आकर कैसा लगा, और क्या कहना चाहेंगे न्यूरो के बीमारी के संबंध में? बहुत बहुत स्वागत है आपका।
पहले तो मैं आपका भी धन्यवाद करना चाहूँगा, और डॉक्टर गुंजन और डॉक्टर दर्शप्रीत जो है, जिन्होंने मुझे ये मीटिंग के लिए बुलाया
जी।
ये एक 3 दिन का मीटिंग है, जिसमें आज वर्टिगो मतलब जो चक्कर की बीमारी है उसके बारे में हमने बहुत डिस्कशन किया। बहुत सारे ज्ञानी लोग हैं जिन्होंने इसके बहुत सारे पेशेंट ट्रीट किए हैं, उनके लेक्चर्स हुए। उससे नए जो लोग स्टूडेंट्स हैं, बाकी के जो स्पेशलिस्ट हैं, उनको भी ज्ञान मिलता है। तो चक्कर के बारे में हमने बहुत सारा डिस्कशन किया।
जी सर।